Most magical freaking video you're ever gonna see. If you didn't believe in PEMF until now, after this you probably will. Want to warn you, okay? We're talking about a dog being spayed. We're gonna see the wound, okay? So if you got a weak heart, just cover your eyes and just listen. Now, you're probably gonna have to watch this video a couple, 3 times, especially the middle part where I show the healing process of PEMF versus normal. But as a pet owner, and like all of you guys out there, you love your pet. And this dog meant the world to me. And I wanted the healing to go as quickly as possible and as painless as possible. Now, we were able to remove the cone after 2 days because there was no licking, no hitchiness, and no swelling whatsoever, which is one of the biggest things that you're going to see during the video. That by itself was a miracle. And the speed at which the thing went was crazy, people. Now, during the video, I'm going to get Mr. PEMF, the narrator, to talk about the normal course of healing, and his font's going to be in yellow. Recky's healing process is in white, okay? I got a couple people to watch the video and they really liked it, so I think we nailed it to trying to do 2 things at once. Today's sponsor, today's program is brought to us directly by Mr. Old Age himself. Yeah, old age. Now, we all suffer from that, and so is our pet. And using PEMF on your pet, putting the mat under their bed every night before they go to sleep, this is a sure way to teach an old dog new tricks. Or is it just make the old tricks easier to do again, like jumping on the couch? Anyway, so let's get the video started on the healing part. Mr. PEMF will give us a quick rundown.
Certainly, Steve. Here's an itemization of what to expect during the first 15 days of recovery. Day 0. The incision site will likely be fresh and raw, and there may be some redness and swelling. Days 1 to 3. You may notice some swelling around the incision site, which is normal. The incision site may be slightly swollen and there may be some bruising around the area. You may begin to notice some mild discharge from the incision site, which is normal and should be clear or slightly pink. Days 4 to 7. Your dog should be more alert and mobile, but may still have some swelling and discomfort. The swelling and bruising around the incision site should begin to subside. The discharge from the incision site may become thicker and more yellowish in color, which is also normal. The incision site should begin to scab over and the edges may appear slightly raised and hard. Days 8 to 10. The incision site may begin to heal and the swelling should begin to subside. Days 11 to 15. The incision site should be mostly healed, with only a small amount of scabbing or discoloration remaining. The area around the incision site may be slightly raised or bumpy as the skin continues to heal. Your dog may still be itchy or uncomfortable around the incision site, but should be showing signs of improvement overall. It's important to remember that every dog is different, and recovery times can vary based on factors such as age, health, and size. Be sure to follow your veterinarian's instructions closely and contact them if you have any concerns about your dog's recovery.
Wasn't that amazing? Like, compare the Ricky path of healing she took versus what typically is prescribed by the vet. So next, I'm going to show you a little montage of day 0 to day 7. I just blend the pictures into each other. Let's just have a look at that. It's freaking amazing again. Okay. It's picture time. Can you help me? Can you help me? Come here. Come here. Recky, come here. Yes. This way. Stop moving. Oh my God, you little worms. Okay. That was amazing. Just love, I mean, I'm making the video and I keep watching it because I'm just mesmerized by it. So I'm pretty sure you guys are like backing up all the time and looking at it over and over and over again. So you probably want to know what I used. I used a bipolar unit that I built for a friend of mine that has colon cancer. And it was a tiny little mat that he's putting on his chest, so I put it right on his back. And there was a delay for him to come pick it up, and I asked him, he's a good friend of mine, so I asked him if I could use it in the meantime, and so I put it under my dog's bed for 7 days. 1 hertz, 25% duty cycle. Now on the bipolar, it's 25% on, that means half of it was north, half of it was south. Why 1%? Sleep better. Now, here's the magic. You guys hear this from me first because there's not a lot of knowledge about this. The bipolar signal is superior than the unipolar signal for healing soft tissue. That means muscles, skin. Bones and ribs and other parts are better off to be healed with the unipolar. A lot of disease and rebalancing the immune system, the jury's still out there. We don't know which way would be better yet. So, soft tissue injury for Reiki, I thought it'd be a good time to use the bipolar. The research also showed this. Now listen to this. This is very rare you hear that negative things about PEMF. But there's one for you guys. They showed clearly that the initial use of PEMF on soft tissue injury using the bipolar signal was excellent for the first week. Thereafter, it actually slowed down the healing. So you're better off to use it for 7 days straight and then let the body take over after that. I'm not talking about bone injuries, I'm not talking about those kind of injuries, I'm talking about soft tissue injuries. There's a whole slew of reasons for that, like names, scientific names like this long and everything else. But just for now, and we'll make a video later on when I introduce the bipolar about the pros and cons of both systems. And I'm going to show you after this some pictures of the Nexian, and I'm going to show you my oscilloscope, the nice beautiful bipolar wave. And I want you guys to know that the Patreons are ahead of all of you that are not Patreon, because they're in the know. They've been in the know for quite a while. I mean, I'm recording this video right now in February, and I don't know when it's going to come out exactly, and they already know about this, so just a hint. Anyway, it was nice making this video. I truly enjoy seeing the healing process, and this is one of those things that proves that the PEMF works. It's not just a rumor anymore. So hopefully you enjoyed. If you have any question, ask and leave a comment. Also, you can reach me at the email. You know what that is, and we'll see you guys soon. Enjoy the next couple pictures of the Nexian. Talk to you later. Bye.